I became involved with the aged care facilities and senior private for-profit facilities when my dad suffered a series of major TIA strokes and lost his short-term memory. His scrotum was blistered, raw from not being changed properly or timely. His teeth hadn't been out of his mouth and I don't know how long. In fact, we had to pry his teeth out to have them brushed properly and put back in his mouth. And it took 2 days of using one of those swabby sticks to get all the plaque and stuff out of his mouth. The government wants these people in these for-profit scenarios and out of long-term care. They're not staffed properly. This particular facility, at the time my dad was there, had 1 LPN for 44 residents and 6 healthcare aides. There is no way in heck that anybody can administer medication for 44 residents without some kind of errors.
And we have a dad that was diagnosed with dementia about 10 years ago, who is now in a local hospital, and he is awaiting room or availability in the facility that will be able to take care of him on a daily basis. So we just need to know that our tax dollars that we pay are being used or being put towards a facility that's going to give this care to him.
And not have to move him outside of Hinton in order to get that care. We feel strongly that my father has, our family has lived in Hinton for close to 60 years, and we shouldn't have to move him into another community.
Absolutely, and there are many here in Hinton that have the same story that we have. And we're just pleading with the government that we need to put our tax dollars towards a proper facility so that we can all stay here in our own community.
We still have folks being shipped out of town when they need extended care. It's happening all the time. We talked to Joy, who runs the Pioneer Lodge here in Lloydminster just the other day. She has 38 people in her facility that need to move to a higher level of care, but there's no beds for them. 38. Just in that one facility. And I asked her, when those people go out of that facility, when they finally do get to move to their higher level of care, do they get to go to Lloydminster? She says, oh, not usually. Usually they go out of town, and then if they survive, they come back. And I say, if they survive, because I have personal friends that were in Pioneer Lodge, went out of town because there was no local facilities, they never came back. They died alone, out of town. This is unacceptable.
And in no time at all, he had catheter issues, right? And he's old and he has too big a prostate and all this sort of stuff that you don't even want to hear about. But there was a blockage and he was sent to emergency and they were told, you have to flush the catheter every 2 days. Like people in the nursing, this is a simple procedure. You got to flush it, twice a day. You got to flush the catheter. And they said, and this is a private, for-profit, long-term care place, they said, we don't do that here. So, well, it's medically necessary. We don't do that here. So we went back, got another blockage within 2 days, was sent back to emergency again. They cleared the blockage, they sent it back and said, you got to flush this, said, we don't do that here. And so he got another blockage, of course, within 2 days. And so he was in emergency 3 times within a week. And then they said to the hospital, don't send him back. We won't take him. They didn't tell us that he had lost his place in the institution. All we heard was, we got a phone call saying, clean out your father's stuff by 5 o'clock on this particular day. We need the bed.
I know there's long waiting lists. Our seniors are being treated like, I'd say, garbage. They're being shipped out away from family, away from their local supports to outside towns. And while the distances might not be great for us, I'm sure they are for seniors. Maybe I'm a bit of an idealist, but I always thought that the government was the steward of the public interest, trying to serve the greatest needs of the greatest number of people. And having the same party in power for 42 years, I think there's a lot of entitlement happening here, and I think other agendas, are compromising the best interests of everyday Albertans. And when it comes to seniors, these are the people that built this province. They've paid their dues, and I think it's really unfair that they bear the brunt of these costs and go into the last phase of their lives with so little support and I guess so little concern for who they are.
We just think it's totally wrong to have to tell people that they must stay here in Sundre while their husband or their wife is sent to some facility a long ways away. I have two very close friends, neither one drive. Both their husbands were sent, one to Silver Lake, one to Pinoca. So they had to rely on getting rides to these areas in order to visit their spouse. And we're a small community.
Yeah.
Mind you, we have a good rural status around us, but they're suffering through the same kind of things. It looks to me like a lot of common sense would replace some of these difficulties. And I would ask the politicians of this province to start putting a little bit of common sense in behind their thinking.
Healthcare is not hamburgers, and corporations are about profit. There's no consideration for dignity of people, for humanity. No, there's no place for corporations in healthcare as far as I'm concerned. That's the role of government. This is why we pay taxes, this is why we work, this is why we contribute to a civil society, and I think we deserve that.
Minister Horn, we've been to Edmonton. We have talked to you about this. You have sent the investigators down. They were found in non-compliance. You promised us that report. We're still waiting. It's 3 months past the fact that you promised it from.